Assalamu alaikum and a very good morning to all of you. My name is Dr. Tanzila Sheikh and I'm here to enlighten some knowledge regarding the early diagnosis and prenatal screening of one of the most common congenital defect, that is cleft lip and palate. Starting with the learning objectives, by the end of this presentation, the students of BDS third year will be able to execute the concept of prenatal screening and the use of various methods for its screening during pregnancy. Explore the diagnostic tools to detect cleft lip and palate in the prenatal stages and understand its significance. Recognize the importance of prenatal counseling for expectant parents and understand to support the affected individual so that the morale can be raised. The significance of early diagnosis is the timely intervention so that a proper treatment and protocol can be followed for the management and a treatment plan of the affected individual. It can significantly improve a child's speech development, nutrition, and overall quality of life if it is diagnosed in early stages of prenatal life. One of the tools for diagnosing the cleft lip and palate is the prenatal ultrasound. In this ultrasound, a test is used as sound waves to create pictures of the developing fetus. When analyzing the pictures, a doctor detects the difference in the facial structures. It is done in the beginning of the 13th week of pregnancy. As the fetus continues developing, it may be easier to accurately diagnose a cleft lip and palate if diagnosed in these weeks of development and at this stage. This is the prenatal ultrasound in which we can see there is a defect in the facial structure. This is the nasal prominences, this is the upper lip prominences or maxillary prominences. We can appreciate a cleft is seen which is extending from the developing lips of lower and upper maxillary and mandibular processes respectively, and this cleft is extending up to the nasal region that may result into a cleft lip. Another diagnosing tool we have is the amnion synthesis. Amnion synthesis is actually the test regarding the amniotic fluid from the uterus. This prenatal screening has results in the performing of a procedure in which there is the sample of amniotic fluid is taken from the uterus. It is seen that the fluid test indicates that the fetus inherit a genetic syndrome that may cause other birth defects. So the defect in the genes can be appreciated or identified at this stage that can help in prenatal screening of cleft lip and palate. So amniocentesis is one of the essential and basic tool of diagnosis of cleft lip and palate. This is the picture of amniocentesis in which the amniotic fluid is taken from the womb of the uterus, and this amniotic fluid is then sent to the laboratory, and the constitutes have been seen in which there is a reported genetic defect in the genes. This gives a signal that there is a prenatal defect in the embryo. Another helping tool we have is the anatomy scan. It can be detected to use as a helping tool that includes an ultrasound which is taken at 20th week, which is also known as anatomy scan during the pregnancy. This can also helps in identifying the feature. Okay, now when the patient parents have been informed during the ultrasound eras that an anomaly or defect has been seen in the facial structures of the baby yet to be born. The next step that we encounter, which is most important, is the counseling and support. So basically, the counseling is important as it provides parents with information, emotional support, and guidance for decision making. The support groups are also present that connect parents with others who have gone through the similar experiences, because in our society there are many cases seen in which the parents have been diagnosed and informed that in the prenatal screening has seen that their child has certain defects, but the parents are afraid and they are very much conscious as they haven't seen any close relative or anybody near to them suffering or going through the same experiences. So there are certain support groups formed that helps in counseling and providing support to such parents, in which they connect the parents with the individuals that have gone through the same problem, individual and the parents, so that they can be made confident regarding their decision making. The support in this manner, the support group plays a very important role. After counseling, the next step we have is planning the treatment and management system, so that the individual born can be protected regarding providing nutrition, and the quality of life of the individual can be made better. So the protocol we have for managing such patient who is natally diagnosed with cleft lip or palate includes prenatal counseling of the parents. Then at from birth to 3 months, lip taping or minor surgery has been done to cover the lip defects. Then 3 to 4 months there is lip repair, which is more extensive. At 1 years of age there is palate repair. At 2.5 to 5 years there is speech therapy, because even the palatal muscles are involved in this defect. And in 6 to 9 years orthodontic treatment and alveolar bone grafting is advised, because there is in cleft lip and palate there is the eruption of teeth is also disrupted. And at the age of 16 to 18 years orthognathic surgery is advised. Orthognathic surgery is advised because of the reason that in cleft lip and palate is seen that there is macropnethia. That means the mandible or the maxilla, uh, normally the maxilla, as its cleft palate, is smaller in size. So to dissolve this discrepancy, after making the teeth in alignment, we go for the reconstruction and the orthognathic surgery. All this help in maintaining the lifestyle of the individual affected from cleft lip and palate, from its nutrition to its appearance to dealing with the world. All these steps help in making their quality of life better. These are the references used for this session. I will share this reference in your account Google Classroom, so you may go through it, and also on the Moodle. Thank you for this session, and thank you for being a good listener. That's all for today's session. Any query or any confused questions are welcome at this email ID to be answered. So happy learning and good luck for your, for your future. Thank you.